Good day, everyone. Welcome to Fighting Fear with Dr. Chandra Smallwood. Here we talk about anxiety, ways to treat it. I talk about my story with it for the last 20 years. And the point is to fight fear because really that's what it is. A lot of fear, a lot of worry. So let's get into it. So today I'm talking about anxiety and SSRIs, or selective serotonin reuptake inhibitor. I know I'm in a lot of USC today. I am super bright. So I took out my braids and I'm conditioning my hair under this beanie. I put the beanie on to keep in some of the warmth from my head. And there's a shower cap under here. Yeah. So I just thought I would match it with a sweatshirt and a little bit of lipstick. All right, so SSRIs. So after I have tried SSRI. I have been on an SSRI. As I probably talked about before, I had a baby in 2020. After I gave birth, I had postpartum preeclampsia. So for those who don't know what preeclampsia is, it's really, really high blood pressure, like abnormally high, and it could lead to eclampsia, which are seizures, which can potentially be deadly. So, I went to the hospital, because I know, being a pharmacist, I know that that is a medical emergency. If you have a baby, I didn't have any high blood pressure at all during my pregnancy. It was normal, even kind of low. So when my blood pressure was checked and it was like, I don't know, 180 over 100, something like that, I was like, oh, whoa, I gotta go. Let's go right now. So it was COVID at the time, and I was kind of having a hard time keeping my blood pressure down, and it turns out a lot of the reason was from anxiety. I mean, as well as the birth, but COVID added an extra element on top of it. So my doctor's like, okay, we have to get the anxiety under control. I'm going to put you on SSRI. I was like, okay, fine. But SSRIs don't work right away. Like, my blood pressure's high now. And I knew that that was a big part of the blood pressure because I went to the hospital a couple of times. But one of the times I went, I was in emergency. They gave me a benzodiazepine, which is like alprazolam, which is Xanax, lorazepam, which is Ativan, something like that, clonazepam, temazepam. People hear anything with ends with a pam. Those are used for anxiety, but they're highly addictive. So anyway, they're really strong. So they gave me one, and my blood pressure came down in a couple of, maybe an hour and a half. So it's like, aha moment. Let's get this anxiety under control. So I started SSRI, but they do not work right away. I'm going to go into some characteristics of the SSRIs, the selective serotonin reuptake inhibitor, and one SNRI, venlafaxine. The SSRIs are citalopram, escitalopram, paroxetine, fluoxetine, sertraline, fluvoxamine, and vortioxetine. Now, all of these cannot be used for anxiety, but I'll talk about the ones that can. But for the most part, the group, they share characteristics, so we're going to talk about them in that way. I'm not going to go into their individual differences so much unless someone has a question, because they're not that different for the most part. So the SSRI that I have tried and still kind of take sometimes is sertraline or Zoloft, which people are probably pretty familiar with. It worked well for me because I didn't really feel anything. I felt the anxiety, I didn't feel it decrease per se, but when it started working and my blood pressure started coming down at the time, it was like, oh, this is great. It kind of dampens the anxiety, decreases panic attacks, things like that. So people describe SSRIs as turning the volume down on their anxious thoughts. This is, I would say, how I felt. It's also an antidepressant, so it makes you feel happier. Okay, so how the SSRIs work. So basically, there's neurons all over the place. It lets out neurotransmitters. So it lets out serotonin. The more serotonin we have, the happier we feel. But what happens is eventually, so the serotonin will hit the receptors, other receptors and other neurons. When those are full, the rest of the serotonin gets sucked back in, basically gets taken out of the environment. So what the medications do is stop it from getting sucked back in. So it just leaves it there. So it can consistently sit on the receptors and it's just there just all the time and just makes us happier. It's just like drinking. It's like, as long you know your cup is full, you enjoy drinking, your cup is full, you're consistently taking shots, you're like happy, 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 happy. But then they cut you off and you're just like, damn. So, okay. So when it comes to side effects of SSRIs, the main ones are gastrointestinal GI side effects. That's nausea, vomiting, diarrhea. Now, I didn't feel any of that when I first started. Like, a lot of times I'll start off on a really low dose, so like 25 milligrams, and then move up to like a more substantial dose that may work better to kind of stop those side effects, but I didn't have those anyway. Can also cause insomnia, jitteriness, restlessness, agitation, things like that, but nothing deadly. They're not dangerous medications. You could drink on them. I'm not supposed to say that. It's not recommended to drink on them. However, there are not fatal side effects to drinking and taking SSRIs, but it's not recommended to drink on any medication. So when you first take the SSRIs, they do not work right away. It's not something you can just take like a Tylenol and all of a sudden, hey, you take a Tylenol, your headache's gone in an hour or so. They don't do that. It'll take 4 to 12 weeks to really see an effect. It has to build up and build up. Most things that people take that augment something in their brain, like their brain chemistry or neurotransmitters, they take a while to start working. So that's very important to remember in case you're looking for some immediate relief. This is not it, not whatsoever. So they're used for different types of anxiety, used for panic disorders, used for generalized anxiety disorder, used for social anxiety disorder, and is tried for other ones as well. So since these are antidepressants, a lot of antidepressants share what are called anticholinergic side effects. These are side effects that basically dry you up. Constipation, dry eyes, which causes blurry vision, dry mouth, urinary retention, dry you up. But they can also cause confusion, impaired memory in some people, or in the elderly. They can cause impaired cognition and memory in the elderly or some people sometimes. When these medications are given for anxiety as opposed to depression, usually they're given in a lower dose. When I started out as 25 milligrams, which is the lowest dose of Zoloft, and I eventually went up to 50. I don't think I pushed any farther than that. I don't think I had to. I started feeling a lot better. I mean, I was also on other medications at the time to lower my blood pressure. Oh, and since then, like, my blood pressure was high for 8 weeks. It went away. I haven't had really high blood pressure since. I've had some like stints or whatever where I was anxious, and my blood pressure went up, but that's few and far in between. I want to add about serotonin. So serotonin is a neurotransmitter that is used for learning and memory function, but is also important for sleep, mood, and appetite. Also, SSRIs are not addictive, and they're very safe for long-term use. A lot of people do use them for a long time. However, when you use medications for depression or anxiety, you really want to have some kind of cognitive behavioral therapy with it, or you're doing something where you're thinking about what you're actually going through and dealing with that as well. I mean, it's fine to be on the medication, but if you don't, get rid of the underlying problem, it's just going to continue anyway. So one of the hardest things about the SSRIs, this beanie is itching my head. I'm about to wash my hair. I'm about to wash this conditioner out. Anyway, okay. So when you start taking the SSRIs, they're an everyday medication. You're taking them every day in order for them to continue to work. You cannot just stop these automatically and say, hey, I'm gonna stop. I don't wanna do this. I tried. It was a disaster. They need to be tapered down. And I would say at least over a month, maybe 2. I was on 50 milligrams for a while. And the reason why I wanted to taper down is because I was having sexual side effects. So SSRIs make you not able to climax. Who wants that? But if you're on the lowish end of the dosing, you don't really feel that as much. But the higher the dosing, the more you have sexual side effects for men and for women. So I was dealing with that, and I was like, I don't want to deal with this anymore. So I was like, I'm going to stop the medication. I feel fine. Like I said, 25 is the lowest dose, 50 is the next dose up. It's like, okay, I cut it down to 25. And like a week later, I had started taking 25 like every other day. Because I knew they had to be tapered, but I didn't really research the taper. I was like, oh, it's not going to be a big deal. I know they're not dangerous medications, so I'm not going to die. Oh my God. I was so sick. Like, I thought I had the flu. Like, I was literally taking my temperature, thinking I had the flu, and I had to really think about what was going on with me. I felt so bad. I was throwing up. I couldn't sleep. When you have withdrawal from something, like if you take something like for anxiety and you stop it, the withdrawal gives you anxiety symptoms. So I was all over the place. I was calling out of work. I was like, what the heck? Once I started taking the medication again, it all went away. It was crazy. So now I take 25 milligrams like every few days. Really, honestly, I take it after I feel like some effects, because if you don't take it for a few days, you start feeling a little like dizzy. People say you get brain zaps. I've never felt that. I don't know what that feels like, but I'll know because I'll stand up and I'm like, oh, I feel dizzy. Oh yeah, I haven't taken the medication in a few days. I'm not really the greatest. I'm not the most compliant patient, and I know I'm a pharmacist, I should be, but I don't take any medications daily. And since it's not regulating my blood pressure or any of my, I don't know, vital organs or anything, it's just not a super high priority. So I feel dizzy, I take the medication. That's just what it is. I don't recommend that whatsoever. But also my anxiety is not super high anymore. I put in a lot of work to manage this, including these medications. And really, when I'm ready to go through the tapering process again, I'll just stop the medication, because it's kind of annoying that I have to try to remember to take it when I really don't need it at this point. But that taper, nightmare causing. I also want to talk about SNRIs, which are selective norepinephrine reuptake inhibitors. Same mechanism of action, as in works the same way as SSRIs, except with norepinephrine, which is a different neurotransmitter, which plays an important role in your attention, focus, and your memory. Basically, it stops the reuptake, the medication stops the reuptake, and the norepinephrine just kind of builds up in your system, making you happier and happier. So, a couple of the more common SNRIs are venlafaxine, Effexor, duloxetine, Cymbalta, desvenlafaxine, which is Pristiq. It's kind of old though. These other ones on the list are not very popular. So anyway, the only one that's really used for anxiety is venlafaxine. Duloxetine is actually used for pain where the prescriber may not know where the pain is from, like emotional pain, pain with depression. Depressive pain is supposed to be really bad. Duloxetine is also used for fibromyalgia, which some people may have, which it's not really known where it comes from, but it's lots of muscle pain, lots of stiffness. So that's used sometimes. So when it comes to the venlafaxine, side effects, nausea, constipation, makes you tired, can cause some dry mouth, dizziness, nervousness, sweating. It can also have those sexual side effects, abnormal ejaculation, orgasm, can cause some anorexia, and is a dose-related increase in the diastolic blood pressure. So diastolic blood pressure is the number at the bottom. Like when you have 120/80, it's the 80. That could increase. But that's dose-related, so usually when you're on a higher dose, there's more chances of that. So blood pressure should be taken if on the medication. Oh, and a lot of times the SNRIs are used when people do not respond to the SSRIs. The SSRIs are first line for anxiety and depression. They work really well, and they're first line. There are actually other medications that work really, really well for these things, especially depression, but their side effect profile is kind of crazy, kind of high. So they're not used as much for that reason, because, especially people who have mental health disorders, like the last thing they need are extra side effects. So, we want to curb all of that. So all in all, I think if someone is wanting to try a medication, I would recommend these. I had a great time. Some people feel numb, they say, like that I've talked to, when they try SSRIs. But if you feel something that you don't like, you can just stop the medication. It doesn't have lasting side effects, where you take it, you get some type of injury inside your body, and then you're stuck with it for the rest of your life. It's not like that. You could try it, say, hey, this is for me, this is not for me, and then just decide to stop the medication. But it did play a large role in my decrease of anxiety at the end, because I was able to really, instead of dealing with the anxiety every day for a while, I was able to really think about what I was going through and develop strong behaviors and other things, like for instance breathing. Breathing is such a godsend. It's so wonderful, and I wouldn't have been able to do that maybe as acutely as I did when I started the medication, because I was able to really kind of live. I had the new baby, I had a new puppy, there was a virus killing. That's when people were dying from coronavirus all the time. Now it's not so common, but before it was just a lot. It was a lot. My baby's daddy had gotten laid off during coronavirus. My parents were staying with me because I was in and out of the hospital due to the blood pressure and stuff. It was crazy times. But yeah, it's all better now. So if anyone has any questions about any of these medications, please let me know. Also, for people who are on the younger side or on the older side of age, these can increase risk of suicide, like suicidal thoughts and ideation, for the most part, in the general, like in the middle ages, you know, maybe like 20 to maybe 50s, 60s, not so much. But it all could happen. So if you try these medications and you feel suicidal or anything like that, let someone know. More likely someone is prescribing these for you, so you have a psychiatrist or a PCP who's managing it, or just tell someone you love how you feel. But to add to that, depression and anxiety, especially since they run together a lot, there's more of a risk of suicide with these disorders than with the medication. It's way lower with the medication, but I just have to mention that.